Mr. Deal.
Thank you, Mr. Chairman. Thanks to all of you for your testimony and your presence here today. Let's set the stage because we've alluded to it from time to time. When we were working on the Deficit Reduction Act, then Governor of Virginia, Mark Warner, was the chairman of the National Governors Association. One of the primary motivating forces for the DRA was that Chairman Warner made the statement that Medicaid was in a meltdown, and he was talking about the pressure that was on states to come up with their portion of the Medicaid dollars. Now, in that context, we still have that concern. My concern is that knowing those pressures are there, both at the state level and at the federal level, I'm concerned that when I see statistics like only 15% of Medicaid enrollment is with people with disabilities, isn't that a significant percentage reduction from what Medicaid used to be in terms of covering those with disabilities? And when those pressures are there on these state Medicaid directors, aren't they sometimes put in a position of making choices that are not always favorable to those with disabilities? And do we need to have some pressure to refocus Medicaid emphasis on those with disabilities? I think we've seemed to have lost some of that focus. Ms. Thomas, am I on the right track about this? And how do we refocus what Medicaid initially was trying to deal with, which was in large part the disabled?
Well, I think that other people that get services like children, and that is also very important and needs to be done. But I think that by passing the Community Choice Act, you would allow people with disabilities to pick what they want, and because the services are generally less costly in the community, you're going to be able to serve more people. What happens at the state level now is that they're required to do the nursing home services, and I've sat in the conference committee rooms where they're struggling with this issue, and I can tell you that that mandate creates a barrier. And instead of being for people with disabilities or children or other what you might call consumers of the services, it winds up being about providers. And while providers are essential, if you put more of the choice in the hands of the individual to pick the kinds of services that they want, then that really helps. And getting rid of that institutional bias is going to be a big step in the right direction.
All right. I was handed during the course of testimony here today the Medicaid release that was released day before yesterday, I think, saying that on Friday of this week, the cash and counseling regulations will be in the Federal Register and comment will be open for a 30-day period. And I think that's a good indication. Obviously, they're going forward with implementing the cash and counseling portion of the DRA and trying to shift more money into that area so people can do things like decide who they want to hire, who they want to fire, instead of it being some administrator or some bureaucrat making those decisions for them, because not everybody who's disabled doesn't have the ability to think for themselves. They ought to be able to make the choices when they want to make the choices, and I think that's in the right direction. And I would urge y'all to comment on that as it opens the comment period as of Friday of this week. Let me, though, go to one thing that, as I told you, for 8.5 years, my wife and I cared for our family, our mother and father, her mother who had Alzheimer's and my mother who had a leg amputated and was in a wheelchair. These were her mother and father, and my mother were all retired school teachers, so therefore income level, they were never Medicaid eligible. But we faced the problem of how do you get people to help? Because I was up here most of the week. My wife was still an active school teacher, trying to find qualified people. And Mr. Grunfeld, you mentioned, and well, Ms. Thomas too, mentioned the lack of available personnel to assist. And that's true both in the Medicaid setting and in the private pay setting of people making these choices. I often ask the question, why don't we have some people that are just giving the basic training to individuals who want to work, but they don't know where to go, and nobody seems to be filling the gap of just basic training. They don't have to be an RN. They don't even have to be an LPN. They just need some basic instruction, because not everybody needs that degree of assistance. Mr. Grunfeld, what's being done to provide these people that we need to fill these slots?
Well, of course, the first thing is the introduction of H.R. 1279 to provide that funding for workers. There's a lot that can be done. One of the biggest issues is attracting people to this field. The 42,000 employees that we have at Rest Care are very dedicated and hardworking and mission-driven. We explain their job as being the toughest job they're ever going to love because they do appreciate what they do. They're very dedicated to the folks that they serve and that they support, and they become part of their family and their friends. But one of the issues is the wages. And what we pay in wages is limited by what we are reimbursed. In addition to that, there's plenty of programs available now in which we could attract future direct service professionals. However, because of the requirements within Job Corps centers, which we are a contractor, and workforce investment services and one-stop services, they don't qualify as part of our outcomes because of the starting wage rate. The expectation is higher than what the starting wage is for direct service professionals. So we could currently be training people in this field, spending dollars that already exist, that are already being spent, not spending any more dollars, and yet attract more people to the field. Now, that doesn't solve the living wage issue. Living wage issue has to be addressed, and there's got to be ways that we look at addressing that. And there's many ways to do that, as I mentioned in my testimony. But at the end of the day, I think that there's a lot of people that want to do this work. There's a lot of caring people in the United States that would be more than happy to provide these services. But they also have to take care of their own families, and then that becomes an issue.
Thank you.